spread your wings. Nothing is impossible, believe. If I can do it, you can spread your wings.
Hello, my name is Sharice Henry. I'm a third year medical student at Queen's University in Belfast. I'm 25 years old. I grew up in Angola. My family and I are originally from St. Vincent and the Grenadines.
Hello all, my name is Dr. Stacey Bryan. I am 35 years old. I grew up in Hackney. My parents are from the Caribbean, so from Jamaica and St. Vincent.
Hi, my name is Dorian Cooper. I'm a GP. I'm 33. I grew up in Montserrat. It's a place in the Caribbean. And then I moved to England when I was about 14. My dad is from Montserrat, my mom is from St. Kitts.
Hi, my name's Ajel. I'm 24 years old and I'm a fourth year medical student. I am from Trinidad and I grew up there until I was 4 years old. So my family are from the same place, Trinidad, but my dad's side is from Grenada.
Hi, my name's Jasmine and I am a doctor. I'm 32 years old. I grew up in Peckham in South London. My family on my mum's side are English with Irish background, and on my dad's side are from Martinique in the Caribbean.
Hi, my name's Alistair, but most of my friends call me Ali for short. I'm 28 and my family are from a tiny island in the Caribbean called St. Vincent and the Grenadines. And like most Vincentians who live in the UK now, I was brought up in High Wycombe.
Hello, my name is Mariella Fortunili and I'm 24, an interim F1 doctor currently working in London. I'm from Forest Gate in East London, that's where I grew up, and my family on my mum's side are from Dominica and Jamaica, and on my dad's side from England.
Hi, my name's Whitney. I'm a foundation year 2 doctor. I'm from the Cayman Islands, that's where I was born. My family is mixed, so my mom is Jamaican, my dad's American, my grandparents on my father's side are Nicaraguan, and now I'm living in the UK.
Hi guys, my name is Dr. Camila. I'm 30 years old and I'm a GP from South London. I've lived in South London all my life. My parents, however, are from the islands of Trinidad and Tobago and Barbados.
Hello, my name's Rochelle and I'm a doctor. I am 31 years old and I grew up in Hackney. And my family is from a small island called St. Lucia.
Hello boys and girls, my name is Josh. I am a foundation year 2 doctor. I grew up in West London. My family is from the Caribbean, the islands of Grenada and Trinidad and Tobago. I wanted to be a doctor because, unlike many other professions, you're guaranteed a variety of experiences and new challenges every day. And I use these to better myself and hopefully my patients' outcomes and experience.
I guess I thought about medicine as a career that would challenge me academically and also allow me to have a lot of time communicating with people in different teams and patients, of course. And it turns out that it does both of those.
Medicine suited me a bit more because I felt like that's where you actually saw another side of humanity, actually.
I wanted to be a doctor because I admired that the profession is focused on improving the quality of life of people. You get the privilege to make an impact in the lives of others. It's also a profession that challenges you intellectually, and you will continue to learn for the rest of your career.
I wanted to become a doctor because I wanted to apply the science that I learned in school to real life, and I wanted to work with people.
I wanted to be a doctor ever since I was little. I think it's because I was always really good at science and I really enjoyed science, and I suppose I wanted to do a profession that could combine the two things that I loved, science and helping people.
I currently work as a GP. I've been a GP for the past 3 years.
And starting my specialty training in radiology.
I'm currently a core surgical trainee and I aspire to be an orthopaedic surgeon. These are bone doctors.
I am a doctor who specialises in obstetrics and gynecology, and what that means is that I look after women who are pregnant and I also help to deliver babies.
I am currently a trainee anaesthetist And what anaesthetists do is put people to sleep when they go for operations, and they also attend emergencies, especially when people are having a problem with the area, which is this area here, and they make sure that people can breathe properly.
My day-to-day job involves looking after patients who have been involved in trauma. This is car accidents and the elderly who have falls, resulting in broken bones. And I'm involved in operating to fix those bones.
My day-to-day job as a first-year doctor is quite varied. So I will see patients and review them, examine them. So using my stethoscope, listen to their chests, examine if they've got any pain anywhere, asking questions about how they're feeling. We use all of these things as clues to work out what is causing the problems and how we can treat it.
I see anyone from teeny tiny babies and doing checks and checking they're well, seeing them when they're unwell, all the way to the very elderly. I do home visits, I liaise a lot between different teams, nurses, pharmacists, hospital doctors, and I really love it.
I work on respiratory, so it involves a ward round in the morning and then doing jobs throughout the day. And then if you have time, going and doing some procedures or working with your registrars, and then sometimes some teaching in the middle of the day as well.
In the mornings, I could be on the labour ward delivering babies, performing caesarean sections, and in the afternoon I may be in a clinic looking after women who are pregnant and making sure that their babies are okay, including checking on babies' heartbeat and making sure that they're growing properly, and also doing some scans where necessary. There are other times where I may be in theatre where I'm operating on women in particular and just helping to make them feel better.
When you are able to make people feel better and you're able to figure out what's wrong with them, and you know, you see them get better and they can come back and thank you, I think that's one of the best things about being a doctor.
It's a job in which you can make a wonderful impact on the lives of other people, and there's always a meaning in what you do.
You are so well trained to deal with very difficult situations that it just feels normal to you, and you actually develop really good people skills as a doctor.
The best part of my job is delivering babies and bringing new life into the world, and just seeing parents be so happy and blessed with their newborn babies.
My favorite part of being a medical student is interacting with patients. It's a privilege to have someone feel comfortable discussing and revealing intimate details of their lives with you. It's a very rewarding experience.
Just being able to make a difference in people's lives is really, really rewarding. And just the little moments where you can connect with patients.
Being a doctor can be very hard, but it's very rewarding, and it's nice to see people recover. When you're studying to become a doctor, you get to learn about all parts of the body, and it's really interesting to learn how the body works and what you can do to help somebody who's sick.
It's really nice because the day goes super fast because you're using your brain all the time, you're talking all day, which is something I like to do, and interacting with people.
The worst thing about being a doctor is not being able to help someone or them not being satisfied with your work.
I think the worst part is the fact that I do miss a lot of family events, like birthdays, and I do spend long periods of time studying. But this is sort of reassuring for me because I know that in the end, all these long hours will be worth it.
The worst part of being a doctor is that there are some people that you can't help, and this is quite difficult, especially when they are very sick. But overall it's quite rewarding and I love my job.
The worst thing about being a medical student is managing my time properly to suit the workload. I am unfortunately a professional procrastinator, and often I tend to leave things until last minute. It's important to pace yourself to avoid unnecessary stress or support work.
I have many hobbies. I enjoy doing photography. I enjoy cooking and baking. I enjoy playing the saxophone, and I enjoy playing football.
Normally, outside of coronavirus, I like to dance. I've danced for most of my life, things like ballet and contemporary, and some hip hop.
My hobbies in my spare time are playing basketball, which I have done since I was 15, and also DJing. I love music and I have a passion for music, and so I keep this up alongside being a doctor.
Some of my hobbies, I love guitar, I play guitar. I just really love music. My favourite animals are horses, and I used to go horse riding when I was younger. I like football, and I was part of my university football team. And I like dancing.
Most of my spare time right now is taken up. I've got 2 boys who are 2 and 3, and they keep me really busy most of the time.
My hobbies are playing football, martial arts, and reading.
I make time for running and painting and swimming and travel. Those things you can't neglect, because when you do become a doctor, sometimes you get a little bit stressed out and you need something to try and calm you down.
So the advice that I would actually give is never let anyone tell you what you can and cannot be, because it's not up to them, to be honest.
In terms of advice or motivation for you guys, I would say if there's something that you love and you're passionate about, go for it. Find people who are doing the job you think you would like to do and ask them questions. People like talking about what they do generally, and they're generally happy to share that. I believe in all of you. You all have the potential to be whatever you want to be.
So one piece of advice I have for those considering a career in medicine is to take time to research if it's for you. Spend time reading books about medicine, reading articles, and arranging some work experience. Take time to speak to doctors like myself, and they can tell you about their experiences.
Stick at it, keep going. You will get there. Enjoy the journey that it takes. Don't rush. You will always reach your destination. Don't let anyone put you off. Don't let anyone make you feel like you can't do it. And just do your best. That's all anyone could ask for.
I think you should fully go for it. You should try and get as much experience as possible.
If at any point in your journey you find that you're unsuccessful, I say keep at it, stay motivated. Becoming a doctor relies on a lot of commitment, but it is a hugely rewarding profession.
Never give up. No matter what your dreams are, what your goals are, just make sure you work really hard to achieve those. And if you want to become a doctor, then you can. Don't let anybody tell you that you can't. Just have to work hard enough.
Don't pursue medicine with half a heart. There will always be circumstances that are not within your control, but when they are, I urge you to try your best. No matter the outcome, you will always be happier knowing that you gave it your all, and avoid worrying about the what-ifs. Pursuing medicine is a very long and challenging journey. It's easy to let self-doubt consume you and prohibit you from reaching your true potential. You must be kind to yourself and don't fall into the trap of imposter syndrome.
So keep on staying focused. The work starts from now. It's never too early. And if you're thinking about a career in medicine, then start reading around. Start talking to people like us, engaging in your science lessons, going to museums. All those sort of things will help. And in terms of tips, reach for the stars. Nothing is unattainable as long as you put your head down. Whatever you put in, you will get out. And remain passionate whatever you do. It's all about your life and your choices. So best of luck, guys.
Spread your wings. Nothing is impossible, believe. If I can do it, you can spread your wings. Nothing is impossible. If I can do it, you can spread your wings.